Welcome to the Parkinson's Foundation Wellness Wednesday program, Participating in Research Studies, What Do I Need to Know? I'm Kim Nitz, a Community Program Manager for the Parkinson's Foundation. Our mission is to make lives better for people living with Parkinson's by improving care and advancing research today until there's a tomorrow without the disease. In all that we do, we build on the energy, experience, and passion of our global Parkinson's community. Our virtual PD Health at Home programs include Mindfulness Mondays, Wellness Wednesdays, and Fitness Fridays. You can register for these on parkinson.org/PD Health. We look forward to the weeks ahead with many exciting programs to come. Today's session will be recorded and archived at parkinson.org/PD Health. It's here that you'll also find our past programs available for your viewing. So we have a lot to discuss today, so let's get started. We are delighted to introduce today's featured speaker and panel moderator, Dr. Ruth Schneider. Dr. Schneider graduated from Brown University and received her MD from the University of Rochester School of Medicine and Dentistry in 2010. She remained at the University of Rochester, completing a neurology residency in 2014 and a movement disorders fellowship in 2015. She then joined the faculty and specializes in the care of patients with movement disorders. I would like to welcome Dr. Ruth Schneider.
Good morning, everyone, or good afternoon, I should say. I'm just pulling my slides up here for you. Okay, so thank you for joining this Parkinson's Foundation Health at Home event. Today, we will be discussing research participation and more specifically, virtual research participation. So we'll start by defining clinical research, and we'll go over some reasons why research participation is important, and then discuss virtual research visits specifically. And lastly, we'll review how to find research opportunities and some things that you may want to consider before you decide to move forward. All right, so clinical research, what is it? Clinical research is the study of health and disease in people. Broadly speaking, there are two different types of clinical research: observational studies and clinical trials. So observational studies are designed to learn more about a disease or about some particular aspect of the disease. One important thing to note is that there is no intervention or treatment in observational research studies. Some examples of ongoing observational research in Parkinson's disease include the Parkinson's Outcomes Project, which has over 13,000 participants across more than 20 different Parkinson's Foundation Centers of Excellence. And this study is seeking to learn more about the experience of living with Parkinson's disease, as well as best practices for taking care of individuals with Parkinson's disease. Another example is Fox Insight, which is an online survey-based study sponsored by the Michael J. Fox Foundation. This study has over 45,000 participants with and without Parkinson's disease. And somewhat similarly, their goal is to learn more about the experience of living with Parkinson's. This is a great example of a study that you can participate in from the comfort of your home without going into the clinic. All right, so to contrast that, a clinical trial, as defined by the World Health Organization, is any research study that prospectively assigns humans or groups of humans to one or more health-related interventions to evaluate the effects on health outcomes. So let's break that down a little bit. So prospective means that information is collected moving forward as it occurs, rather than looking back or asking people to recall what happened months or years ago. And an intervention could be a variety of different things. So an intervention might be a drug or a device or a therapy such as exercise. And there are different phases of clinical trials, and each phase has a different goal. Phase 1 studies typically study the safety of an intervention in a healthy population without the disease that's being studied. So in this case, you would study it in individuals who do not have Parkinson's disease. Phase 2 studies examine the safety of an intervention in individuals with Parkinson's disease, and they try to get a better sense of, or some signal of, whether the intervention would be effective or not. Phase 3 studies involve large numbers of individuals with Parkinson's disease, and they're designed to determine whether the intervention is effective and to confirm safety. Lastly, there are Phase 4 studies, which are post-marketing surveillance studies. These are studies that are undertaken once a drug or a device has already come to the market, and they enable long-term examination of the safety and effectiveness in a very large group of people, much larger than you could have in the context of a clinical trial. So one example of an ongoing clinical trial is the TOPAZ study, which is examining a medication called zoledronic acid and its ability to reduce the risk of fractures in individuals with Parkinson's disease. Now, I decided to highlight this study because it's another example of research that allows you to participate from the comfort of your home. And this is quite unique as an entirely remote clinical trial that is currently ongoing. So now that we have some understanding of what clinical research is, we can talk about why research participation is important. So research participation and your participation in research is absolutely critical. So we know that your participation helps to advance our understanding of Parkinson's disease. It helps us identify new and better treatments for Parkinson's disease, and it can help others who are living with the disease as well. Without your participation in research, we would not be able to achieve any of these objectives. Now, you may be thinking, we're in the middle of a pandemic. How can I participate in research? Which brings me nicely to virtual research studies. So COVID-19 has undoubtedly made us reconsider how we conduct research studies and how to best prioritize the safety of our research participants, as well as our study team members. Many traditional research studies, and by that I mean studies where you would have to go into the clinic on a regular basis for in-person visit, have been halted, or startup of new studies has been delayed due to the pandemic. So many other research teams have had to adapt their research design or their plans to enable remote assessment. So what I mean by remote assessment is assessment outside of the traditional clinic environment. And this might take a variety of different forms. So one option would be telephone visits. Other options including mailing questionnaires to the home, as well as digital tools like smartphones or wearable sensors, which can collect information that we can't capture during telephone visits or questionnaires. And then lastly, virtual research visits. And for the remainder of this presentation, we're going to focus on the latter, on virtual research visits. So what are virtual research visits? Virtual research visits are video-based visits that are conducted in real time between a research participant and a research team member. And so you can see an example over here of what a virtual visit might look like from the investigator standpoint. By not requiring people to travel to a clinic, virtual research visits allow more people to participate in research and to do so in a way that is hopefully more comfortable and more convenient for them. So I'm going to share with you some of my experience conducting virtual research visits in order to highlight some of the advantages and disadvantages of virtual research. So point one, virtual research visits allow people living across the United States to participate in research that is conducted from a single center. So here is a map showing the distribution of participants in one of our ongoing research studies called VALOR-PD, or Virtual Assessment of LRRK2 Carriers to Optimize Research in Parkinson's Disease. So you can, maybe a little bit difficult to read the legend here, but the darker blue represents states where there are more than 16 participants, whereas the lightest color blue has somewhere between 1 and 5 participants, and white are states that are not currently represented. So the purpose of this study of Valor PD is to follow and learn more about individuals with and without Parkinson's disease who have a particular LRRK2 genetic variant that puts them at higher risk for developing Parkinson's. And so as you can see here on the map, we have over 30 states that are represented. And such a study would not be feasible if we were using traditional site-based in-clinic recruitment. So the reason this is possible is because people can participate from the comfort of their home. All that is required is an internet-enabled device. This could be a computer, a tablet, or smartphone, and a connection to the internet. But of course, virtual visits are not quite the same as in-person visits, and there are some disadvantages that we can't ignore. So for one, not all of the tests that we do in the clinic can be performed remotely, and some tests require modifications. Lastly, the quality of the internet connection and the setting or the environment that the visits are done in can make a big difference as far as the quality of our assessments and the data that we're able to gain. All right, so point 2, virtual research visits are safe and feasible with people with Parkinson's disease. So I mentioned one study, but we've done a couple other virtual research studies over the past couple years. And across 3 studies, we've completed over 550 virtual research visits with people with Parkinson's disease over the last 2 years alone. In that time, we have had 1 fall occurring during a visit. Now, of course, I would like that number to be 0, but I think it's still reasonable to conclude that these visits are safe. On the right on your screen, you'll see a graphic showing the number of items in our standard motor assessment that we've been able to complete. Now, as you can imagine, some of the things that you may be used to your clinician doing in the clinic, like moving your arms and legs around to assess your muscle tone, or pulling on your shoulders to assess your balance, those can't readily be assessed remotely. So this is excluding those items. We are able to capture 98% of the remaining kind of standard elements of the motor examination. And we'll talk more on that later. Point 3, virtual research visits are generally well-liked and well-received by participants. So I'm showing you information from 2 different research studies here. On the left, you'll see a graph from a large trial of virtual visits in Parkinson's disease called Connect PD that was done by some of my colleagues at the University of Rochester and elsewhere. And so you'll see that satisfaction levels were over 90 to 95% across all of the different areas that they assessed. On the right, you'll see our early data from Valor PD, which is our study of LRRK2 carriers across the US. And you'll see similarly that satisfaction rates exceed 95% for each item. Now you may notice that technical quality has the lowest satisfaction ratings in both studies. And I think this is pretty consistently the element of virtual research visits that is lowest rated. Okay, so before we jump into the nuts and bolts of virtual research visits, I would like to ask you to respond to this polling question. So you should be seeing this on your screen. And the question is, have you ever participated in a research study with virtual research visits? Okay, so it looks like we have a few experienced individuals on this call, but most of you have not participated in a virtual research visit. So I'll walk you through some of the different aspects and things that you might expect during a virtual research visit. Okay. So during a visit, you can expect to see many familiar tests. So here's my kind partner demonstrating some of the aspects of our standard motor examination. So I imagine that much of this is likely looking familiar to many of you. And so you can see here for this next video, I did have to adjust the position of the camera. All right, and we'll show you one more here. And then I had to adjust the position of the camera again to better evaluate walking. All right, so you may notice some differences here. So as I mentioned before, during this video, I can't assess rigidity or muscle tone, and I can't assess postural instability or balance. And as you can see, and as I mentioned, some repositioning of the camera is necessary and should be expected. So I'm showing you an example of just the motor component of a standard research visit, but of course there are many other assessments and tests that you may be asked to do during a standard research visit. Many of those can also be done during a virtual or remote research visit. And so for some of the tests, particularly for some of our cognitive tests, you may be asked to print out a form in advance of the visit, or you may be sent something by mail in advance of the visit. And then we may ask you to hold that form up to the screen so that the study team member can better evaluate your responses. And one thing you'll also for sure notice is that there is far less paperwork with these virtual research visits than with in-person visits. Because we are evaluating you at home, there are some unique considerations. And your study team may take several steps to ensure your safety. So I'm going to walk you through some of our standard safety processes as an example. I don't want you to take these as kind of what any virtual research study would include, but just as an example of things that might be a little bit different about it to make sure that you're safe and comfortable at home. So first off, we routinely collect your location and your emergency contact information in case of a medical emergency. So if something were to happen, we want to make sure that we can best assist you. And in order to do that, we need this information. We also will always make sure that you're comfortable standing and walking before we ask you to do so. And if you typically use an assistive device like a cane or a walker, then we would only have you walk with your normal assistive device. So for example, if you use a walker to get around the house, we're not going to ask you to walk without your walker. And so again, these processes will vary depending on the research study and what's involved in the study. Some of the surveys or questionnaires that you would typically complete during an in-person study visit can be shifted to outside of the study visit. This has some benefits. So for one, you can expect your visit to be shorter, okay? At the University of Rochester, we often use a data management platform called RedCap, which allows us to email participants a link to complete surveys and questionnaires online in advance of the visit. So you'll see on the right a screenshot of how that might look to you. The nice thing about this is, not only can we send them to you in advance, but you can take the time to complete it at a time that is convenient for you and return to it as often as is needed, rather than needing to do it under the watchful eye of a research team member in the clinic. Okay, so what do you need to do to prepare for a virtual research visit? So I think I mentioned before that there are a few things that are essential to participating. One of them is internet access, and preferably high-speed internet access. And the second is an internet-enabled device with a camera. So this could be a computer, a tablet, or a smartphone. Sometimes studies will provide a web camera for you if you have a device but you don't have a camera, so that you can participate in the research study. And I have my opinions on which types of devices are preferable, but really any of these will work. As you might imagine, some of them are a little bit easier to manipulate and reposition. So a desktop computer with a web camera is probably the most difficult to work with, just because it's hard to reposition the camera to capture all of the different aspects of the exam that we hope to get. However, again, all of them are certainly doable. Okay, so from my perspective, preparation is really key to having a successful virtual research visit. And to this end, you may be asked to complete a test visit. Now, the purpose of the test visit, which is typically run by a research coordinator, is to, one, make sure that you know how to connect. Okay, so there's no issues with whatever platform or software is being used to conduct the visit. Troubleshoot any technical issues that do arise, such as if you are having trouble getting your video going or the audio quality was poor. And then to go over kind of in more detail what's going to happen during the virtual research visit and what to expect. So these are really seen as your opportunity to ask questions and make sure that you understand kind of how the visit is going to run and what you're going to be asked to do. So during the actual visit, I recommend that you expect that you're going to need to reposition yourself and or your camera or device, right? So I showed you the examples of doing not even the full motor exam, but just some components of the motor examination. And I think you can appreciate that some of the aspects of the motor examination are really easier to assess up close, and other aspects are better assessed from a distance. And it's nearly impossible to get everything from one angle or from one perspective in a room. So, you know, expect that you're going to be asked to move around, potentially move a chair around, move your computer around, those sorts of things. So what are some tips to make ensure a successful visit? So number one, I think it can be really helpful to have a family member or care partner present to help. So as an investigator, I love having a videographer present to help with the visit and to make sure that we get the highest quality assessments possible. It also helps to prepare your environment. Now this isn't anything complicated, but things such as wanting to make sure that you have good lighting, right? So we want adequate lighting, but we don't want backlighting. So it's not ideal if you're sitting in front of a large bank of windows with beautiful lighting, although the view may be gorgeous. And for a lot of these assessments, we will ask you to walk if you're comfortable doing so. So having in mind a kind of space where that you think would work for that, potentially a hallway or just a room that allows you to walk kind of away from your camera and then back towards your camera, and clearing that space if needed in advance of the visit can also be helpful. Lastly, as I mentioned before, sometimes you may be asked to take out a piece of paper for the visit or to print something off in advance, or perhaps to have a medication list handy. And if we can do those things in advance of the visit, that again makes everything go a little bit smoother and makes the visit go a little bit faster. All right, so maybe, just maybe, I've sparked your interest in participating in research. And I'm sure you have questions, which we will answer, but where can you go to find more information? So one resource is clinicaltrials.gov, and you see a screenshot here of their website. Clinicaltrials.gov is an online database of clinical research studies that is provided by the National Institute of Health. And so this is a great resource to go in and search for ongoing clinical trials. And you can enter specific terms, right? So you can look at Parkinson's disease, or you can look for specific drugs that you may be interested in learning more about, or different types of interventions. Another good resource is Fox Trial Finder, which is an online database of Parkinson's disease research studies specifically, that also allows you to register as a participant, and either as somebody with Parkinson's disease or without Parkinson's disease, and to indicate your potential interest in participating in a future research study. And then lastly, I'd say don't forget to talk to your healthcare team, right? So there may be other opportunities locally that are not on either of these registries. And it's always a great time to ask your healthcare providers about research opportunities during any visit. So I want to end just by reviewing a few things that you may want to consider if you're thinking about participating in a research study. So this is not by any means an exhaustive list, but hopefully it gets you thinking about what questions you might want to ask if you're considering research. So one, and I think this is one of the biggest one for many people, are what are the requirements for participating in the research study? And there's a lot that goes into this question, right? So one is, how many research visits are there over the course of the study? How long is the study? Are these visits in person or are they virtual? What is going to be done during these visits? So what type of testing or assessments are included? Is this an observational study or is it an interventional study? And are there requirements outside of the study visits? So for example, sometimes we'll ask folks to keep a journal of how they're feeling throughout the day. Or if you ever participate in a study of digital technology, you may be asked to do different activities on a smartphone application or on another piece of technology. Next question that you may want to consider is whether there are any direct benefits to you. So we talked about the importance of participating in research and really how this helps us generate and learn more about Parkinson's disease, different aspects of it, and kind of benefits the community as a whole. But there aren't always direct benefits to you as an individual research participant. And this is important information for you to understand. The next question might be, what are the risks? And so you might be thinking that, well, it's an observational study, maybe there aren't any risks. And while I think certainly the calculation is a little bit different for an observational versus an interventional study, no study is without risks. So one thing that you might think about are, is there any risk to my privacy or confidentiality with participation in this research study? Another question would be, well, who can see my data? So this is important because you want to make sure you understand who your data is being shared with, right? So is this something that only your research team will be able to see, or are they working with an outside institution or another company that may also have access to your data? And then lastly, how will, or will they at all, will your results be shared back with you? And I think there are really two parts of this last question. So one is, will you receive the overall study results, right? So are they going to share any kind of research results or publications, presentations with you as a research participant? The second part of this question is, will you have access to your individual data? And I think this is something that's coming up more and more in recent years, is how we can kind of thoughtfully and meaningfully share back data from research participation. All right, so thank you all for joining. I'm going to turn things back over to Kim for now, but start thinking about questions.
Excellent. Thank you so much, Dr. Schneider. I think we could all find that very encouraging, how research is continuing during this pandemic. So that was some great insight. For some additional great insight, we would like to bring on a few of our folks living with Parkinson's and a care partner today who are going to share some of their direct experience participating in Parkinson's research. So I will first turn it over to Charles and Stacy Warren, and then after that, David Blonsky, who will share some of their own personal insights with us today. So Charles and Stacy.
Good afternoon, or good morning, depending on where you're located. My name is Stacy Warren, and I am a care partner for my PWP, my person with Parkinson's. He's also my husband and my business partner. So Charles was diagnosed with Parkinson's in 2018. And so soon after that, we went to the Parkinson's Foundation and gathered as much information as we possibly could. And in June of 2019, we applied for and were accepted for the Parkinson's Advocate and Research program. So the PAIR program is what we went to Minnesota for 4 days and took training and learned how to be advocates in research. And this is really important to us because without the research and the studies, there's no way we're going to get closer to a cure. So it's really important to us. So I'm going to turn it over to Charles.
Yeah, thank you, Stacy. After you've decided that you want to participate in research, as Dr. Snyder said, there's a list of questions that you should confront those who are part of your medical team with, and she gave those. But the commitment ought to be that you become a partner with the research team. You're joining a team now. And after you've satisfied yourself that all of the safety concerns, et cetera, have been addressed, and you signed the informed consent, now you're off and running. It's time to meet your investigator or investigators. I'm going to share an experience that I had working with the Center of Excellence located at the University of Kansas here in Kansas City. I found out about the opportunity through my support team. One of the members was a participant, and we were talking about it, and it sounded really fascinating. And so he said, well, I'm sure we need other participants. And I think, as Dr. Snyder will attest to, you never have enough participants. So I set the things in motion to become a partner in research with 2 local doctors, medical doctors. These guys were actually in medical school, and this was a part of their educational process. And we had a very successful first meeting in which I learned about their objectives for the trial and got all my questions in. And then subsequently, I was given 4 vials, citrus, rose, eucalyptus, and clove. Now, those of you with Parkinson's knows that a loss of smell is potentially one of the effects. Anosmia was the study that I was participating in, and the objective was to baseline and then see if it's something you can retrain. It's what Dr. Snyder referred to as an observational study because I wasn't receiving any intervention or therapy. I was only contributing with my data. So far, we've had 3 visits. They have committed, as Dr. Snyder alluded to provide me with results of the overall study. I will tell you this, these guys are really good, and the investigators honor the internal review board requirements and the regulations that they have to follow, because I was constantly asking questions, my own natural curiosity that would push the envelope on this, and they would say, well, Charles, when we get the results, and we can talk about those things. So all in all, it was a very positive experience, and the study is still ongoing. I don't yet have the results, but and then one final thing here. Yesterday, supporting the virtual notion of value add through the virtual process, I spent 4 hours on the phone with 21 people from literally around the world. And that was an effort to support a Parkinson's Foundation's partner as they were designing a study. So virtually throughout the day, there were 5 people here in the US and 5 in the UK, all of which were asked to give input into the design process for an upcoming study, up to and including what are we going to name it. They wanted our input there. It was fun. It was a long day, but we did it all virtually, and it was quite successful. So our own experience has been here locally. I traveled to the Center of Excellence at KU Med. Probably the biggest problem was finding things inside that huge complex. But we worked through those, and the investigators were very helpful, and it truly was a partnership. And for me, I wouldn't hesitate, and I would encourage everyone to look for a partnership of your own and get involved in study, research study. Back to you, Kim.
Awesome. Thank you, Charles, for your insight. That's some great experience to share. We've also got David Blonsky now, who is going to share his research experience with us. And Dave, can you hear us? Let's see.
We're getting some feedback here.
Oh, there we go.
Okay. Again, diagnosed in 2014, July 2014. But prior to that, I spent 30 years in the medical device industry, working through the complicated processes that they have for introducing or getting approval or clearance for medical devices or drugs associated with, for example, Parkinson's. So the important thing that I want to say, it's very complicated. It's a very intense process, but the foundation of that process is really the research part of it. And getting a good base and research foundation is going to be key to having a successful product that gets launched and it can improve quality of life or can lead us toward a cure for Parkinson's. Personally, I've been involved in a couple of key clinical research studies. One, the PD generation study at the Struthers Institute in Minnesota, Twin Cities area, that really take a look at the genetic variants, and it was the most in-depth, comprehensive clinical study I've been part of, with a follow-up genetic assessment done by the lead investigator at that site. So very, very fulfilling, very, very nice. I mean, as far as being comfortable in a setting like that, you may go in with some certain thoughts that, it may get uncomfortable. You may not be able to answer questions, but really, it's really they make it a very relaxed setting. The only thing in that case was they had to draw blood on site, so that could have been essentially a virtual type clinical study that we were talking about earlier. But within 2 weeks, they had my results, and we sat down for an assessment, and it really gave me a sense of completeness and satisfaction as far as the clinical study goes. The other study I'd like to highlight is I went through a study with gait balance and the attention study, also done at the Struthers Institute. And the neat part about that was it was very simple standing up in a chair, walking in a circle for a certain amount of time. But the neat part about it is my caregiver, my wife, was able to join me as a normal volunteer for that study as well. So gave her some insight into what I've been doing after going through the research advocate training last year, and gave her insight to the facility at Struthers and to the people there, and the way we were treated was outstanding. So it's very comfortable, very easy to do. I mean, the important thing is you got to realize as an advocate, though, that each of these clinical studies and each of the people involved in the clinical studies it's very personal to them. It's not something that one size fits all kind of thing. So you need to make sure that as an advocate, you're talking to them about the pros and cons of each study, trying to give them as much information as you can. And if that takes one-on-one sit-down sessions with some people, I think it's important to do that as well. So, but overall, I mean, for the past year, I think it's been an excellent learning opportunity for me, even though I've been through the medical device industry. And I think it'll continue to do that. And I think it'll be interesting to see which way virtual research studies are going to go and what documentation we're going to be required to have from those research studies that are virtual versus the typically handwritten or computer-generated document.
Okay, thank you so much, Dave. And that's awesome that your wife was able to get involved as well. So now we would like to take some questions that we have received from our audience, and we're going to hand those to our experts. I'm going to start with a question for Dr. Schneider. The question is regarding whether I need to tell my doctor if I'm getting involved in a research study.
So I generally recommend having open communication with your doctor and the rest of your medical team. This is particularly important for interventional studies, right? So if we're studying a new drug for the treatment of Parkinson's disease, or as a potential treatment to slow down the progression of Parkinson's disease, there may be some concerns about interactions with some of your other medications. So that's one of the big reasons why we would like your health providers, generally speaking, to know when you're participating in research studies, particularly interventional research studies.
Okay, great. Next question, and I'll give this to Dave. Any tips on handling people who might react negatively when I say I'm going to get involved in research? You know, they appear to be scared for me. Have you ever had to handle anything like that?
You know, I think I have, Kim, and it's really a matter of not understanding exactly what's involved in the process. I mean, sitting down and going through the informed consent form kind of gives you a detailed listing of what exactly to expect. But I think even then, there's still questions that you can answer on a one-on-one basis. That I think the research advocates, I mean, that's really part of their role. And not only part of their role is to be genuine and sympathetic, but empathetic as well, so listening to their concerns and making sure that you know, they're comfortable once they get in there, and nothing is really going to surprise them after as they go through the process.
Okay, thank you. A question for Dr. Schneider. Any guidance on how to distinguish what may not be real research? So what kinds of things I look for to know that this is a valid research engagement?
Well, I think if it is presented by your medical team as an option for research participation, that's probably a good indicator that it's gone through the proper channels. I'm not sure entirely what the participant means by real research, but you know, certainly you should expect that you will receive an informed consent form for most types of research. It depends on kind of the level of research, but for most types you will receive a written informed consent form. And you'll likely see on this a little stamp or something on the bottom that says, you know, reviewed by the Institutional Review Board, and then a date associated with that. And so that may be one thing that you can look for. And if you had questions about the study, you know, you could always reach out to the Institutional Review Board directly at your institution that you go to for guidance there. Hopefully that answers your question.
Great, thank you. I have one for Charles on, for you and Stacy, what were the questions that, or maybe the question you found most important when evaluating a study? What did you need to consider for the both of you to know it was the right fit?
Yeah, thank you. I think for me, it was, what am I really signing up for? We talked about the consent form. It's important to recognize that the consent form is not a contract. You want to complete the study, you want to go through the entire process, and you want to make every contribution possible by working with the research team. But if at some point you're uncomfortable for whatever reason, or your situation changes, you can drop out of the study. It's not a contractual agreement. So I think knowing that going in, and we never, of course, in an observational study, it's a different situation, David was actually giving blood and a much more engaged and in-depth study. But it's probably situational, and because I was observational, we didn't really confront that. But the important point, I think, is it's not a contract.
Excellent. A question for David. David, how important was genetics to you in your research participation?
Well, it was one of the top research studies that I was really trying to get involved with. And to be honest with you, I had to spend some time trying to reach the investigator because this is a very popular study, just in general. But you know, knowing the genetics that go beyond just the basics of genetics for Parkinson's, and knowing the expanded version of the variants of the 7 or so other genetic markers, and being able to talk back to the lead investigator and understand what each one means was key for me. I mean, I could then share that with, if I wanted to, with my family, my children, making sure that they understood that, you know, if there was a risk. I mean, basically what we know right now, it doesn't exist. So to be, you know, affected by Parkinson's, one of their children or one of them personally affected by Parkinson's. So I think it was important for me, just that sense of again, sense of relaxation, that, you know, hey, this is something that came from environmental exposure. It wasn't really me or my parents or anything like that associated with the disease.
Great. Thank you for that. And next, I've got a question back to Charles and Stacy. What is the longest study that you've been a part of, and the frequency of the visits? And would you foresee any barriers if, for example, a study was a year or more?
Yeah, that's a great question. A year and planning a year ahead is difficult for most of us. The longest one, of course, is probably Fox Insight that we're all engaged in. If you have Parkinson's and you're working through the Parkinson's Foundation, in terms of the longest, the most visits that I've had, the study that I was a participant in, they told me up front it would be 3. And 3 over a relatively short period of time as we were in a phase 2 mode. And the biggest challenge for me was learning what the smells were. Stacy had to help me with, you know, what is citrus supposed to smell like, or rose or eucalyptus. Now, eucalyptus that was interesting. But 3 visits, it was all defined up front. Yesterday, the work that I was involved in that I alluded to earlier, they were talking about some studies that could go on as long as multiple years. And what are the things that the investigative partners have to build in to those study designs? And so I think it's important to recognize that those things are considered up front, and as carefully and as well as they possibly can are all shared with potential participants.
Great, Charles. And I actually think we're going to take our last question here that is for Dr. Schneider. I'm going to read it to you and we can interpret what the question's getting at. What are some tools for sharing information regarding research participation, especially during this time when we don't see each other frequently?
So I guess there's probably a few different ways to answer that. So from a participant standpoint, I think Charles had alluded to before this kind of peer recruitment process. So we actually, at least at the University of Rochester, do get a fair number of referrals through this unofficial peer network, which might be through your local support group or perhaps an exercise class or other events that you participate in locally. Now, I recognize that a lot of those are not happening in person right now. Many of my patients are now doing boxing classes via Zoom rather than in person, which is not quite the same, but I think we still have these opportunities for kind of informal communication where study opportunities might be passed along. The other thing I will say is that some of the web resources that I put up earlier, like clinicaltrials.gov or the Fox Trial Finder, those are things that are still readily accessible right now. And of course, you can still always talk to your research team about kind of opportunities, or your medical team about opportunities for research participation. Some local medical centers will have their own registry. So for example, at the University of Rochester, we have one where we have people sign up if they are interested in being contacted about research opportunities. And so there may be something similar at your local medical center as well.
Excellent. Well, that does conclude our program today in the Q&A segment. I want to thank again Dr. Ruth Schneider from Rochester, as well as Charles and Stacy Warren and Dave Blonsky. It was a pleasure having you with us here today and sharing some great insight with us. Please do remember that this session will be recorded. If you'd like to encourage others to view it, you'll be able to find it on parkinson.org/pdhealth. That's also where you'll find information on registering for our upcoming programs in the weeks ahead. So please visit our site there. Also, if you had a question today that was not answered, please know we provide free resources, including our website, parkinson.org, our toll-free helpline staffed with Parkinson's experts at 1-800-4PD-INFO, as well as a number of educational books, other webinars, podcasts, and our Aware and Care Kit. And finally, we hope that you will join us next week for PD Health at Home. Our program will be What is Happening in Research During COVID-19 with Danielle Larson, Madeline Hackney, and Denise Coley. It will take place at the same time next Wednesday. Until then, we thank you for joining us. Please continue to stay well.